Welcome to our community broadcasting network featuring the Health and Wellness Best Practices podcast. Today's program is hosted by Colorado State Senator Dafna Michaelson Jenet, who serves as Vice Chair of the Senate Health and Human Services Committee. This is the first of her monthly podcasts to give ongoing updates on health and welfare programs and legislation formulated by the Senate Health and Human Services Committee. Her special guest is Senator Kyle Mullica, who serves as the HHS Committee Chair. They will be discussing the committee priorities for the 2026 Colorado legislative session.
Hi, everyone. I'm State Senator Dafna Michaelson Jenet, and I am really excited that you're here for my inaugural podcast, where we're going to talk about issues in the health and human services space in the legislature. And for my very first guest, I have the esteemed Senator Kyle Mullica, who is not only the chair of the Health and Human Services Committee, but he also serves as an emergency room nurse and is living the life of a medical provider in the legislature. So I think he'll have a lot of good words to say. Kyle, why don't you join me?
Perfect. Thank you so much. Thank you for having me, Dafna. Really excited to be here.
I'm excited that you're here too. So, we're coming into the year with some really heavy issues around insurance, SNAP, Medicaid, um, many things that we can't control that are being impacted on the federal level by HR 1. What are some of your thoughts on how we're going to deal with some of these issues?
Yeah, appreciate that, Dafna, and I agree with you. I think we have our hands full, with I think a lot of trickle down impacts that are coming, to our state in regards to HR 1. And whether those consequences are intended or unintended, we know that there is going to be a huge impact in a number of different areas for the residents of Colorado. And unfortunately, those impacts are probably going to be felt most by some of our most vulnerable members of our state. And I think that that's I know one of my goals, and I think a goal that you and I share, is to how do we limit that impact, and especially that impact on our most vulnerable populations. And the mindset I've taken around this is that I'm not against having conversations around HR 1 and potentially what Congress and the federal government are attempting to solve with HR 1. But those conversations never happened. And, I think this policy is being placed in Colorado really without that outreach and without trying to figure out how to accomplish those goals and how to do that in a way that's not going to have a drastic negative impact on the people of Colorado. I think that's what I'm most disappointed in, and it's going to be something that we have to figure out as legislators here. I think, from a health insurance standpoint, and not renewing the premium tax credits before the end of the year, we're looking at, upwards of $150 to $200 million impact on people's healthcare premiums. And that's real access. Those are real dollars for people, hardworking folks who need that insurance in case something happens. And now they're having to make those difficult decisions on if they get to keep that insurance or not, or if they can afford to. And that's just, that's unacceptable. And so, we're having long and hard conversations on what that looks like and how we can do that, and really bring industry together and really get that buy-in from industry to help us solve these problems and help us make sure that these folks have access to healthcare, that they have access to their insurance that they can afford, and that we're doing all that we can to make it more affordable. And how do we all start rowing in that same direction? But HR 1's not just impacting health insurance; it's also impacting, some of our welfare programs like SNAP and TANF, and how our counties are operating, and potentially what share of those benefits that the state pays. And obviously, you and I both know the budget situation that we're going to be in as a state here in Colorado, and the cuts that we're going to have to look at making, and the difficult decisions that we're going to have to look at making. To add more cost to our state is going to be a really difficult thing. And so, what can we do as a state to make sure that we can continue ensuring that those folks have access to these really important programs that ensure that families have food and are fed, that they have dollars to be able to buy the necessities that they need, and that our counties can continue doing the good work that they're doing. And those are conversations that we're having as well. Is how do we ensure that that's going to happen as well? So we're battling multiple fronts right now.
Yeah, we definitely have a war going on against people who are in need. And the cruelty of HR1 is going to be felt. And we're going to feel it in the Health Committee with all of the work that we do this year. And I'm looking forward to working on that with you. I know in the past you worked on an incredible bill to make sure that our people who need care are able to access that care, even with the HR1 and other terrible things that are happening in our society right now. And I just wanted to thank you for that and your commitment to our people who are in need is very meaningful to the state of Colorado, and we're very lucky to have you. I'm wondering if you have any bills that you are excited to bring forward in the next year that you can talk about at this point.
Yeah, we're specifically around HR1, what we're talking about. We're having a number of meetings to try to really come up with solutions to make up for the dollars that we're losing from HR1 for that come into our reinsurance program and our health affordability enterprise program, and really trying to find some solutions there. It's in the hundreds of millions of dollars. But really kind of trying to approach it from a different angle, the conversations I'm having of, how do we start putting downward pressure on premiums? I think that we have to be conscious of just continuously putting money into the system, but really not addressing, the trajectory that our premiums and the cost of healthcare is on, which is not a sustainable one. And so really trying to kill two birds with one stone right there is, some of those conversations that I'm having. We're having conversations on how we can start putting downward pressure on homeowners insurance premiums, which is, hurting a lot of working class individuals, seeing their premiums skyrocket. And a lot of that's due to hail in our state, and what can we do around that. And then the other thing that I'm really excited to work on, or, one of the other things I'm really excited to work on is around public health and immunizations. And really, what can we do as a state to continue insulating ourselves from some of the dysfunction that we're seeing at the national level? We know that science matters. We know that vaccines work. We just saw RFK Jr. come out and change the vaccine schedule. And this is putting people at risk, and it's not science-based. And so, we need to figure out what we can do as a state to continue making sure that our schedule is not impacted, that that doesn't trickle down into our state, and that we have vaccine schedules and public health policy that is based in science that protects the people of Colorado. And we're working on a bill that we'll be bringing this year that builds on some of the work that we've already done in that area.
Can you expand a little bit more about how we as a state can protect ourselves? Because when this news came out about the change to the vaccine schedule, I, as a parent, was horrified, and I live in Colorado. What is it that we can do specifically that protects us from the vaccine schedule that has been put into place?
Yeah, no, I appreciate that. And it's really disappointing because, the CDC are leaders in the world. Everyone looks to us, and the work that we've done around vaccines and the millions of lives that we've saved with that science. And to see it kind of being drugged through the dirt is really disappointing, and it's dangerous, and so what we're doing in Colorado is last year we passed legislation that allows our state board of health not to look at ACIP, which is the federal schedule, and look at other sources that are like the American Academy of Pediatrics and what their recommendations are to set our schedule, rather than relying purely on the federal the federal schedule. I think, obviously as an individual, I think up until recently, you could look to the CDC and look at the research and the recommendations that they're doing. And now I think you have to kind of step back and really have that conversation with your provider, and get that information to make sure that what works best for you and your family. We know vaccines work, but we also know not everyone can get them. Some people may have allergic reactions. Some people may be immunocompromised. But it's for those people is why the vaccines are so important, is that the vaccines protect them because they can't protect themselves. And we need to get to a level of herd immunity. And I think with the level of disinformation out there, and that disinformation now coming from, our government, who are supposed to be, really based in science and facts, is disturbing. And so I think we just need to pull it back a level. And that's what we're doing in Colorado. We're going to bring it back local, to make sure that, the right information, science-based, evidence-based information is being used, and that we're doing all that we can to protect the people of Colorado, and that they're getting the information that is science-based and is evidence-based.
Do you think that we're going to face some challenges with measles here in Colorado?
Yeah, I don't think it's a coincidence that, we as a country have seen, the most cases of measles that, in 20 years, when we thought that we had pretty much eradicated measles. And I do think we're at risk. We've seen outbreaks already in parts of our state. We know from the data that there are more vulnerable communities than others, and that's something else that we're working on, is how do we get the information? How do we get those vaccines into those communities and make them easily accessible? Sometimes it's not just purely, a view-based issue. It could be a location issue. They could be more rural and, just a harder to serve community because of their location. And so we really need to try to meet those folks where they're at. We need to make sure that those folks have access to science-based, evidence-based information, and make sure that, we are getting communities to a level of herd immunity so that folks are protected, so we don't see these vaccine preventable outbreaks. There's folks in certain communities that downplay the impacts of measles, but there's long-term impacts. It's extremely contagious. People are truly harmed, and you can't tell me that, polio or smallpox or, these other viruses and vaccine preventable diseases just disappeared. We know that they're not here causing real harm, killing people because of the science and because of those vaccines. And and to see the disinformation coming out of the CDC and the secretary is really disturbing. And obviously, there's nothing we can do about that right now, but we can do something as a state to try to insulate ourselves, to make sure that that they don't control our schedule, and that we're trying to get that information out that's fact-based and science-based.
Well, I, for one, as a parent, am particularly grateful to you because you've been working on the vaccine area from the beginning of your time in the legislature, and you're in year 10 now?
No, this will be my 8th year. I did 4 in the House. And then I think you did 2 more in the House, and then I came, and then this is my 4th year in the Senate. I think this is your 2nd. So, and you've been right by my side in these battles, fighting for public health, Dafna. And so, a lot of kudos and thanks to you. And we're not going to let threats or, some of the things that we've seen, come our way because we're fighting for public health, stop us from fighting for the right thing. Unfortunately, we, have to battle, a secretary who is putting out, misinformation about this and now controls the CDC. But, we're going to fight to protect the people of Colorado.
Well, I just want to say thank you, Kyle, for spending time with me today. And I am very much looking forward to that battle with you at the helm. And we will protect the children of Colorado. And we will also make sure that our community has access to things like SNAP and TANF and Medicaid. It's going to be a big battle with a terrible budget year facing us, but we hope you will join us along the way as we follow the Health and Human Services Committee throughout the year. Thanks so much for spending time with us today.
But if I can just say how thankful I am for Dafna Michaelson Jenet. She is a true leader. She fights for what she believes in, and she fights for really vulnerable people. And if you want to look at the things and the growth that we've had around behavioral health in this state, and the things that we've done, and the protections that we put in place for our children and for folks who are facing a behavioral health crisis, there is not a bigger champion that I've encountered, even in other states when I go talk to other state legislators around the country. We are truly lucky to have Dafna Michaelson Jenet in this state, and to see what she fights for and how she lives her values every day is it's nothing short of inspiring. So you can say thank you all you want, Dafna, but I'm saying thank you, and I think the state should be saying thank you for the work you've done.
Thank you.